This PowerPoint presentation will include the following: facts and data about the opioid crisis, and the 8-step change model in applying it to my community problem of the opioid epidemic. In this slide, we will talk about the summary of the 8-step change model. The 8 parts included in the 8-step change model are as followed. Step 1, create urgency. Step 2, form a powerful coalition. Step 3, create a vision for change. Step 4, communicate the vision. Step 5, remove obstacles. Step 6, create short-term wins. Step 7, build on the change. And Step 8, anchor the changes in the corporate culture. Step 1, create urgency. The opioid epidemic is a public health emergency taking so many lives of loved ones each day. There are more than 130 people who die every day from opioid-related drug overdoses. From 2015 just to 2016, overdose mortality rates in the United States increased by 21%. Step 2, form a powerful coalition. The opioid epidemic not only includes overdose and deaths, but also unemployment, lost productivity, and exacerbation of behavioral health conditions. There are various factors that will increase an individual's risk of misuse, addiction, or overdose while taking opioids. If you are 65 years or older, or have a respiratory condition such as COPD or asthma, it can increase your sensitivity to opioids. There are greater risk of opioid deaths associated with extended release and long-acting opioid formulations versus immediate release formulas. Step 3, create a vision for change. There are many steps needed for change both in a community and in state and federal governments. Power leaders within the community need to set out funding and more prevention interventions to eliminate the use of drugs within our communities. Some power leaders within the community are mental health board, commissioners, judges, family members, and lawyers. Step 4, communicate the vision. Individuals need to address and speak out about the substance abuse that is taking place in our communities. Getting community members involved in organizations that help individuals who struggle with substance use. Step 5, remove obstacles. There are a lot of struggles and obstacles that are in place in preventing and ultimately eliminating the opioid crisis. If we stand together as a community, we can make a difference. Funding for organizations is one of the biggest obstacles that we face in the fight against the opioid epidemic. Step 6, create short-term wins. Urgency and organization within the community that are already in effect are short-term wins against the fight against opioid addiction. Thanking for a change in homeless shelters providing resources on a daily basis create support for those who need it the most. More can be done every day to help this ongoing fight with substance abuse disorders. Step 7, build on the change. Communities are scaling up to prevent overdoses and to provide overdose prevention interventions. Syringe services programs are being put in my community to eliminate the spread of HIV and AIDS. Host community mobilization events to put tools in the hands of every community sector and to provide education to those fighting a battle with substance abuse disorders. Step 8, anchor changes in the corporate culture. Healthcare professionals face barriers in addressing the opioid crisis and providing care to patients with SUDs, but they also recognize that these patients face barriers in seeking treatment. An educational program for graduate students studying health science was put into place upon further research of the opioid epidemic. In this article, overall the program was feasible, enjoyable, and effective in meeting its goals and increasing knowledge and improving attitudes among students in a greater community. Education about opioid use is vital to saving the lives of many within the United States during the opioid epidemic. School systems can host public speakers and educate students about the dangers of drug use and getting involved in the community. Final assessment of change success. Our communities and power holders are stepping up to the end of the ongoing fight with the opioid epidemic. Overall, the system being put into place and the systems already being that are put in place bring overdose and substance abuse disorders down, but we still need to stand strong and take away the stigma associated with substance abuse within our communities. Conclusion. The current opioid epidemic is a problem that is social, cultural, and economic, and needs a societal and cultural transformation to diminish the opioid crisis. Addiction shows no favoritism and reaches all ages, races, socioeconomic classes, and genders. More than 1 million opioid pills are distributed in the U.S. every hour. More than 932,000 people have died since 1999 from drug overdose. Nearly 75% of drug overdose deaths in 2022 involve an opioid. There are many different approaches that can be engaged within communities across the United States to save the lives of many loved ones.